Hello again, ladies and gentlemen. This is your nurse educator, Waitanase, and we continue with the lesson of obesity. Now, what we'll be doing on this video is formulating a nursing care plan, but with this one, we'll only be highlighting the goals and nursing diagnosis, so that when we get to the learning task 3, then that's where that we're implementing actions for the nursing diagnosis. This is where this is where the learners will be actually formulating a full nursing care plan. This is just to give them the highlight of what is expected of them a bit in the learning task number 3. Okay, let's continue. So the goals of the nursing care plan is to achieve weight loss to a specific level and maintain weight loss at a specific level, modify eating levels, and lastly, participate in regular physical activities. Now, this is the goal that the patient needs to achieve. This is the reason why we do the nursing care plans. Okay. So the nursing diagnosis we have, number 1 is an imbalanced nutrition. This is more than body requirements related to excessive intake in relation to metabolic need and decreased activity. So nursing diagnosis number 2, impaired physical mobility related to excessive body weight. Okay. Number 3, social isolation related to alterations in physical appearance and perceived unattractiveness. Number 4, impaired skin integrity related to alterations in nutritional state, which is being obese, immobility, excess moisture, and multiple falls. Number 5 is ineffective breathing pattern related to decreased lung expansion from obesity. Non-compliance related to alterations in perception or lack of motivation. Now this is number 6. Number 7 is disturbed body image related to deviation from usual or expected body size and inability to lose or retain weight loss. Now those are the 7 nursing diagnoses I've come up with, and I've taken them from the handout of medical and surgical nursing, 6th edition. Okay, so furthermore, excuse me, for the lesson, there are various treatment modalities now, which is collaborative surgical care. Now this part is just when all plans or therapies have actually failed, or the client is unable to follow due to various reasons. So now we have 3 most common surgical care. 1, which is lipectomy. So this is performed to remove slightly flabby folds of adipose tissue. And liposuction, it's a suction-assisted lipectomy. So patients who choose these 2 surgical care, they do those for cosmetic reasons. Okay. And the most commonly used one is gastrointestinal surgery, which is the Roux-en-Y gastric bypass surgery. So in this surgery, it is to limit food intake by removing half of the stomach. Okay, so for patients to be selected for any operations, they need to meet a certain criteria. So in this criteria, the patient needs to have gross obesity for 5 years and above. And number 2, failure to reduce weight with other forms of therapy. Number 3, body weight is 100% above the ideal for age, gender, and height. Number 4, no serious endocrine problem causing obesity. So when they need to go under surgery, they need to rule out such endocrine problems. Okay. Number 5, absence of other medical conditions such as liver disease, alcoholism, cardiovascular or pulmonary disease, inflammatory bowel disease. Number 6, psychiatric and social stability and willingness to cooperate with long-term follow-up. So before the patient undergoes the surgery, they need to carefully, psychologically prepare the client for the immediate and the long-term care. Okay. And number 8, there needs to be presence of a high risk condition that weight loss would ameliorate, which that means to make better. So if the patient has a condition and actually going for the surgery, it's going to make the condition much better, then definitely the client is going to undergo the surgical care. So far, ladies and gentlemen, the lesson that I've prepared, I took the lesson from medical and surgical nursing, which is assessment and management of health problems, which is the 6th edition. And I can't remember the authors. Okay, let me look up the authors, right? But it's chapter 39 of nutritional problems. Yes, authors of that book, it's Lois, Heidkamper, and Dixon. Those are the authors, 3 of them. In the medical and surgical nursing assessment and management of clinical problems. And the other book I've used is Medical and Surgical Nursing, the 12th edition of Branner and Sudduth textbook. So on my last video, I'll be going through the learning tasks, more of it in detail. Thank you very much for watching. Bye.